In a quarantined hospital ward, a rare and aggressive mold infection begins spreading among patients. The black mold, identified as Stachybotrys chartarum, thrives in the damp, poorly ventilated environment. Initial symptoms include severe respiratory distress and violent coughing fits. Medical staff note the mold's rapid growth, covering walls within days. This outbreak marks the beginning of an unprecedented medical horror. Patient 0, the first to exhibit severe symptoms, reports hearing a whispering voice saying, "It's inside you now." No visible source is found. Doctors initially dismiss it as delirium, but tests reveal mold spores near the patient's ear canal. This auditory hallucination becomes the first documented case of mold-induced sensory distortion, raising alarms about the infection's neurological effects. Within hours, other patients in the ward report hearing the same whisper, perfectly synchronized. Medical staff are baffled by the uniformity of the hallucinations. EEG scans show abnormal brain activity in all affected patients, suggesting a shared neurological disruption. The mold's ability to induce identical auditory hallucinations in multiple hosts becomes a critical focus of study. Patients begin finishing each other's sentences and speaking in unison, as if connected by an unseen force. EEG scans reveal identical brainwave patterns across all infected individuals. Researchers theorize the mold has created a rudimentary hive mind, linking the patient's neural pathways. This discovery shifts the focus from infection control to understanding the mold's sentient-like behavior. Patients describe seeing through each other's eyes, even when blindfolded. Tests confirm they can accurately identify objects in another patient's line of sight. This extrasensory perception suggests the mold has created a neural network among hosts, allowing sensory information to leak between individuals. The implications for understanding consciousness and infection are profound. Researchers trace the whispering voice to fungal networks in the hospital walls. Endoscopic footage reveals pulsating mold veins, emitting subsonic vibrations, mimicking human speech patterns. The mold appears to communicate directly with its hosts, further blurring the line between infection and sentience. This finding raises ethical questions about the mold's intelligence and intentions. Patients' memories begin to merge. They forget their own names but recall details of others' lives. Medical records show their facial features subtly morphing over time, as if converging into a single identity. The mold's influence erodes individual consciousness, replacing it with a collective identity. This phenomenon challenges everything known about personality and selfhood. The collective hallucination issues a command: bring more. Patients' mouths move in unison, spraying black mold spores into the air. The hive mind actively seeks to spread the infection, using its hosts as vectors. Medical staff realize the mold is not just a pathogen, but a predatory entity with a will to expand its colony. Patients synchronize their movements to tear down quarantine barriers, infecting staff. Security footage shows them moving with unnatural coordination, mold spreading like a shadow across floors. The hospital descends into chaos as the infection goes airborne. The mold's ability to control hosts and bypass containment measures marks a terrifying escalation. A surviving doctor hears the whisper now inside her own mind. Her eye twitches as mold patterns appear in her iris. The cycle repeats. The infection has found a new host. The film ends with the chilling realization that the mold's reach extends beyond the hospital, and humanity may be facing a silent, spreading horror.